morning, everyone. Welcome to episode 42 of ADHD Tiny Superpower Knowledge. Today's topic is on ADHD, Dialectical Behavior Therapy, also called DBT. It helps with emotional dysfunction in ADHD people the most, and my psychiatrist introduced this term to me, and so I did some research, and I hope you pay attention to this episode. Dialectical behavior therapy, so I'll call DBT, is a promising treatment for reducing anger and violent behavior. This especially can be triggered by PTSD, as mentioned in my previous videos. This mode of therapy addresses maladaptive behavior by teaching emotion regulation, distress tolerance, interpersonal effectiveness, core mindfulness, and self-management skills. We ADHD people unlash, so I call it. We have to express our emotions, or else there will be an imbalance in our physical and emotional function and well-being. But in most circumstances, especially for adults, we can't be throwing tantrums like children can and get away with it. So we bottle the emotions up, and unleash is what dangerous for ADHDers, holding out the negative emotion for too long, and we blow up. In adult situations, this can happen. So seek therapy as soon as possible for this, and try looking up DBT. So practice emotion control is important, whatever way works for you. If you have to hit something, if you have to hit a tree with a cane, that's what I do, then that's what you need to do. Get it out. DBT was used to treat other mental conditions before it was adapted to treat ADHD. It's brainchild of Martha Linehan, PhD, a professor of psychology at University of Washington and founder of the Linehan Institute. DBT was designed to withhold bouts of emotional turmoil, including self-harming behaviors such as cutting for those diagnosed with borderline personality disorder, characterized by unpredictable mood swings and reckless behavior, chaotic relationship, extreme reaction to stress, chronic risk of self-harm and suicide. But we're not really talking about borderline personality here, but with ADHD, they do interact sometimes. Linehan's DBT is now the go-to treatment for improving emotional regulation skills. In those diagnosed with anxiety with ADHD, DBT rests on scientifically sound behavioral and cognitive strategies, and incorporates skills like mindfulness and acceptance principles. DBT skills include fostering the wise mind, the balance between the logical and emotional minds, self-soothing activities, and acting in ways that are in contrast to the immediate distressing emotion. For instance, smiling during an upset situation just because we need to. Behavioral change requires specialized skills and strategies, but as most of us know, implementing them is tough for adults with ADHD. So impulsiveness and inattentiveness is another for ADHD. This one area I find the most difficult to learn and deal with on daily normal basis life. I can't seem to not do things impulsively and without even registering into my brain what I was doing, because it's an inner impulse. And that's what impulse is. The formal definition is a sudden, strong, and unreflective urge to desire or to act. So unreflective, sometimes you don't even think about it. So what can you do? One is what I suggested in previous episodes about holding off responding back impulsively, such as emails. Waiting for 24 to 48 hours of time allows to think about the email, think about the possible responses that you can do to encourage the other person or communicate, negotiate with the other person, instead of jumping into blaming other person right away.